And thank you to Jay, and we have Paige here today helping interpret, so thank you to both Jay and Paige for being here this morning. Before we go to the numbers, I am wearing a special mask today. I don't know if you can see it, it's got a lot going on, but it's Ruth Bader Ginsburg, and it says, "Fight for the things you care about." So I thought it would be important and timely to wear this mask today as we celebrate the life and the legacy of RBG in our community and throughout the nation. She served for 27 years in the Supreme Court, as many of you know, and I think, interestingly, became a bit of an icon, especially in her latter years, especially for young people. I have a young intern in my office. Her name is Lizzie, and she looked up to RBG. I am, as you know, the founder of the Commission on Women and Girls here in Hamilton County, and the girls love RBG and would wear T-shirts and collars. I just think it's so interesting that she represented what is good about the Supreme Court, about someone that's a jurist, people making thoughtful decisions on behalf of the country. And I'm going to tell just one very brief story. I had the opportunity to go to the Supreme Court a number of years ago, and I took my two kids with me, Sarah and Andrew, and we sat out in the audience. It's a very it's a restricted environment. You have to be very quiet, no cell phones, the whole thing. And so as we sat there, the two of them, and they were both college age, were most interested in was RBG, and watching her as she leaned in towards the microphone in that huge chair that she sat in as a very small woman, and leaned in and gave her opinion about the case that was being heard. So, rest in peace, RBG. We're going to miss her thoughtful approach to being on the Supreme Court. So let's get to the numbers. So as of today, in Hamilton County, we have 12,850 positive cases of COVID-19. The change from last week is 482. The number of hospitalizations is up to 1,120. The change from last week is 28. And the number of deaths in Hamilton County stands at 309. The increase from last week is 7. Greg Kesterman is here this morning. Thank you for coming back, Greg. We missed you last week. He is going to run through the numbers and the trends with us, as always. We also have Sarah Bolton with us. Sarah is the Senior Vice President of Programs and Services for the Health Collaborative, and she's going to discuss the new Test and Protect program. This is the testing program that the county has invested in, and the Health Collaborative is rolling out in collaboration with the hospitals in our community. As we have previously reported here, Hamilton County and the Health Collab have partnered to provide testing for county residents at no cost to the patients. We have been using pop-up sites in critical neighborhoods, and that will continue. But the Health Collab is also adding recurring sites that will be opening on a predictable basis so that people can access that testing and have some predictability as to where to go. First, though, we're going to talk, probably I think for the last time, about the census. A key reminder, the census count ends September 30th. We have 1 week left for the census. Hamilton County has now surpassed our final count in 2010 in the self-response rate, but there are so many people left to be counted. An undercount has real consequences and means Hamilton County could miss out on $1,800 per person of federal funding every year for the next 10 years. So over 10 years, it's $18,000 per person that's not counted in Hamilton County. That is a tremendous amount of money for us to leave on the table. This money goes to roads and bridges and schools and hospitals, all the things that are critically important. And these are the federal dollars that are in partnership with us at the local level to provide these services. We cannot leave money on the table here in Hamilton County. So please, I implore you again to please fill out the census if you have not done so. My2020census.gov is the website. Takes about 5 minutes. Unless you have a lot of children, it'll take 6 minutes. So please get on there, and fill out your census form. We need every adult and child in this community counted. So there will be door knocking going on until September 30th, next week. So if you don't want that knock on the door, go online and fill out the census. So I will implore you probably one more time during this broadcast to do that, and then hopefully our count will better reflect the population in Hamilton County when we finally get those numbers in. So with that, we're going to go to Greg first for the numbers and the trends.
Well, good morning, and thank you, Commissioner. We continue to see new cases in Hamilton County, although there have been no major spikes since I was last year. We see them kind of ebb and flow. Hamilton County remains a level 2 on the Ohio Public Health Alert Advisory System, which I believe truly to be testament to the hard work that our residents are doing throughout Hamilton County. So thank you everyone for your hard work. Before I dive into the numbers a little bit, I'd like to start with a slide showing some information about testing, and then I suspect Sarah Bolton will talk more about it a bit later in the press conference. These testing sites that are shown on the graphic in front of you are from the Health Collaborative's website. That website is healthcollab.org/test and protect. Once again, healthcollab.org/test and protect. We encourage folks who need testing to go get tested. Remember that if you have symptoms of COVID and you need to get tested, there are many locations throughout the county. These sites on the screen are for the Health Collaborative sites, the Test and Protect program. You can also access additional sites through our website, which is hcph.org. If you have a need to bring testing to your business or to your community, this is another resource to make that request. I would encourage folks to check out that website and access this if you need to bring testing to you. Lastly, if you do decide to get tested because you have symptoms, if you have any kind of symptoms that could be related to COVID and you get a test, we're asking you to stay home until you get those test results. In addition, if you have been exposed to somebody that has COVID, the same holds true. We're asking you to stay home until you get those test results. It's very important to help slow the spread of COVID-19. I want to touch base now on Hamilton County cases. So we have, as I mentioned, seen a little bit of ups and downs in the last few weeks, although generally things have leveled out. We continue to see cases countywide. We continue to see about 80 cases when you look at all of Hamilton County. Each of these cases requires contact tracing and quarantining individuals that are close contacts. So our team continues to quickly reach out and to make sure that we're able to get a hold of folks that have been in close contact and to help slow the spread of COVID-19 through this work. We've had great success working with folks that have been close contacts, and I encourage you that if you get a call from one of our team members, work with them so that we can continue to do so good in Hamilton County. We also have spent a lot of time looking at the age demographic data. You might recall a few weeks ago we talked about the 18 to 24-year-olds contributing significantly to the case increase. In fact, at one point we saw positivity rates for tests coming back around 18%, which is extra high and significantly higher than any other age demographic. This number is now down closer to 11%, which is excellent news. I'm very hopeful that some of the work that county commissioners have done and others have done to message this population are starting to be successful. We still have work. I'd like to see this number get closer to the county's positivity rate, which is about 3.5%. But I'm glad to see that number come down, and we'll continue to work with this age group to get things back to where we hope to see them. Looking at all other age groups and age demographics, things remain fairly stable with their test positivity rates. No other surprises. Similar to case numbers is our reproductive number. Yesterday, as a county, we were at 1.0, and today we dropped down to 0.88. So once again, another great indicator showing that things are continuing to stay fairly level and overall in the right direction. We just need to make sure that as a community, we continue to wear our masks and do all of the infectious disease measures that we've been talking about throughout this pandemic. As a region, we are at 0.89, which is also very positive for us. When looking at deaths and hospitalizations and intensive care unit admissions, these continue to remain low as well. We know that these are delayed indicators, so any kind of increase because of previous spikes take a few weeks to start to show up. But at this point, we are not seeing any significant increases of admissions into our hospitals or our intensive care units. This holds true also when you look at our 14 county region. The 3 indicators continue to remain low. As I've shared previously, this is important because the resources, our hospital resources, our ventilator resources, they are shared regionally. People come to Hamilton County for those services. So it's very important that we track both of these numbers, and those also remain low. We'll switch in, talk a little bit about Halloween. I was not here last week, but there were several questions related to Halloween. The governor and the director of health released their guidance documents on Friday of last week pertaining to how Halloween can happen. And essentially, there are no restrictions for Halloween. We are asking our community to make sure that we are following the same pandemic plan that we've been following throughout. If you're sick, you shouldn't let your children go trick-or-treating. Or if you're planning on passing out candy and you're feeling sick, we should not participate. In addition, we are asking folks to wear masks, and I'm not talking about scary masks, I'm talking about the cloth masks underneath your outfit. Or, you know, Halloween is a holiday of creativity. I'm asking families to get creative and to make sure we're incorporating safety into our plans this year. In addition, if you're going door to door, you might want to consider limiting the number of doors you go to. And probably most important from my perspective, not everyone feels comfortable with your child coming up to their door and knocking. This year, we really need to respect the lights off. If the lights are off at a house, I'm asking you to make sure your children aren't going up and bothering that home. Many people are still isolating significantly because of concerns and underlying health conditions, and we really need to respect those wishes this year. I think we can have a somewhat normal Halloween, but it takes us working continuously as a community to make it successful and to make sure we don't see any increases in disease. So I'm asking parents once again to help reinforce the message both with their young kids and college students. Masking is important. It's not a political issue. It helps slow the spread of germs. And so wear your mask, help teach your children how important it is to wear your mask, and make it acceptable to wear your mask when you're out in places that you might not normally do so. I'm encouraging everyone to work together. We all want things to get back to normal, whether it be Halloween or continuing to see more sporting events in our community. And this is the biggest thing that we can do to help make fall feel more normal. We should be, as a community, proud of ourselves and our hard work. And I appreciate everyone and everything that we're doing here as a community in Hamilton County. Thank you.
Thanks, Greg. So next we have Sarah Bolton, again from the Health Collaborative. One of the strategies we know we need to employ as a community is increased testing. And so Sarah is going to talk about the partnership not only between the county and the Health Collab and the hospitals, but localized communities that are requesting testing at certain sites in those communities. And so Sarah, I know you're joining us virtually. Welcome. Please talk to us about Test and Protect.
Yes. Thank you, Commissioner. Appreciate the time this morning. So I'm Sarah Bolton with the Health Collaborative, as mentioned. So Test and Protect Hamilton County Cares Testing Initiative is a partnership between Hamilton County, the Health Collaborative, and 8 trusted health organizations to deliver safe, reliable COVID-19 testing in neighborhoods that need it the most. So Hamilton County is providing additional resources to areas seeing an increase in positive cases, because we know that early detection is key to the long-term suppression of the pandemic. So Test and Protect's goal is to provide safe, reliable, free testing where it's most convenient. So near your homes, it's available to all Hamilton County residents and those who work within the county as well. So when you see a Test and Protect sign, you can be sure that you will have a smooth, convenient testing experience. And again, the goal is really to bring that close to home for you. So I do want to pull up a screenshot of, oh, I'm not allowed to share, that's okay, of the website. So it was mentioned earlier, so we encourage you all to visit healthcollab.org/test and protect. And that's really the one-stop shop where you can access all this information. So you'll have daily updates to testing locations that are available. So that'll include both semi-permanent recurring locations, as well as those more pop-up ad hoc locations. And those are all available to the general public, as I mentioned, those who live within the county or those who work within the county. There's also the ability to contact us through that site, as Commissioner Kesterman mentioned. So if you are a community member or part of an organization where you feel like you need testing brought on site, we are happy to accommodate that. So you can go ahead, access that website, healthcollab.org/test and protect, and there's a contact button that you'll see at the top. When you click on that, you can fill out a short number of questions about the need that you have, and we will put that into a prioritization queue. And you should be contacted within between 24 and 72 hours with some additional questions and our ability to get you in the process for scheduling. So our goal is to continue to add more semi-permanent locations that you can come to rely upon, as Commissioner Dreihaus mentioned. So we're very excited to announce some upcoming partnerships that aren't yet reflected on the website with the YMCA of Greater Cincinnati, as well as the Cincinnati Public Library. So you'll see those sites begin to be reflected onto the website itself later this week. I believe our first testing within Cincinnati Public Library location will go live this Friday, and there'll be more information later today or tomorrow on the site about that. But again, the goal is really to have access for all residents and employees within the county in a 10 to 15 minute accessible free format. So we really want to make it barrier-free. The goal is to provide that convenient testing because we know that early detection is the most critical part. So again, healthcollab.org/test and protect, you'll find frequently asked questions, all the testing sites that are available. And then again, if you have a specific need that you feel is unmet for your organization or community, you can request specific testing via that site as well.
Okay. Great. Thank you, Sarah. I want to hone in just a little bit on this idea that the pop-up testing will be available, and that's fantastic. But also this idea that if you work or frequent an institution or a place of business that you think needs testing, you can reach out to the Health Collaborative and ask them to come into that facility and do testing. I think it's a really, it makes you stop and think for a minute, what kinds of organizations or businesses would this apply to? And Sarah, I hear you saying anybody can apply to have testing come into their site. There will be a list of questions asked, but when I think about that, and please correct me if I'm wrong, I think about maybe church congregations, I think about businesses that have a significant number of employees, I think about maybe a business that has had a positive test for one of their employees. I mean, is that what we're talking about here when someone reaches out and says, can you come in and provide testing to us?
Yeah, those are great examples. A couple others I would add to that. So think of populations where transportation is a challenge. So maybe a senior living facility, not a skilled nursing facility, but a group of seniors that reside within tight quarters together. That might be an example of it's hard for them to travel. It's hard for them to get out and get transportation to a site, even if it's just down the road. So we could come into that building, for example, and test. Whoever is interested in testing. The developmentally disabled is another example. So think of populations that it may be extra challenging to go into a public setting for testing. Those requests are great to come through the site.
Very good, thank you. And one other example, Greg Kesterman shared with me earlier, he had a meeting with the fire chiefs in the county, and one of the fire chiefs said, can you come in and test the firefighters, the first responders in that particular community? So another example of how this might be utilized. So it's a pretty exciting program. We've invested a lot in this program, knowing that it can have a very positive impact on the tamping down the spread of COVID in Hamilton County. So we're very excited about the pop-up testing, about the congregate testing. So thank you to Sarah and the Health Collab for being our partners in this, and as always for Greg Kesterman and kind of leading the way on how to best do this and how to best organize. So with that, I think we're ready to go to questions. Bridget Doherty is virtual today, which is throwing us all off here in the room, Bridget, to not have you here. But I know we've got a little bit of a pause here, so we will pause for a moment and have you convey a question, and then pause and get that reporter up on the screen.
Okay, so I believe Raven Richard has our first question. She's from WCPO, and I believe it's for you, Commissioner Dreihaus.
Hi, good morning. So later today, Senator Brown is supposed to announce a Black Women's Health Symposium. So can you talk about the importance or the struggle with minority health here specifically that we've been seeing, especially during the times of COVID?
So yeah, what we know about COVID is that it impacts people of color to a greater degree than what is represented in the population. So that is true also for the Latinx community. And so when we talk about COVID, when we talk about other health disparities in this community, we need to make sure that as we talk about the testing sites, as we talk about pop-up testing, as we do this work, we are especially focused on the communities that are impacted by these health disparities, and in this case, the spread of COVID-19. And so we have been very deliberate in reaching out to some of our partners in the community to make sure that the messaging is going into places where the population is most at risk. And so that includes churches, that includes organizations like Closing the Health Gap that are particularly tied in to the Black community in Hamilton County. We have Santa Maria over on the west side talking to the Latinx community in Hamilton County and all of their partners. And so it's critically important that we understand the disparity, first of all, and then can respond to that disparity. So I applaud the senator for doing that work. We know that there are health disparities. Our resolution saying that racism is a public health crisis in Hamilton County also talks about these disparities. And so we are all, I think, marching in the right direction to make sure that we are addressing a need that we know is there in Hamilton County and beyond.
Thank you.
Okay. We'll give it a second here to see if anybody else has any questions. Looks like Raven may have taken everybody's question. I don't see anybody else asking a question. It's a short day.
A short day, that's right. And so I do want to mention that, okay, first of all, census, you've got 1 week. Next week, next Wednesday, it ends. Please, please fill out the census. It helps everybody, please. So next week, we're going to be talking about voting. I have had a great deal of, not concerns so much as questions into my office about how people vote, where people vote. And so we're going to have Gwen McFarland and Alex Triantafilo. They are both on the Board of Election. We've got a Democrat and a Republican to make sure that it is a nonpartisan conversation. But we're going to talk about voting and access to voting in Hamilton County. Where is the drop box? How do you vote by mail? What are the deadlines? And so all of this information will be talked about at our next briefing. How is the Board of Elections retrofitting that facility to accommodate what we think is going to be a large population voting early, whether it's in person or driving through to drop a ballot in the drop box? So I think it'll be very informative. Both of them have agreed to come on. So I'm very excited about that. As we move into the election cycle for 2020, we need to make sure that people have the right information about voting. So please join us next week for that. And thank you all for being on. Thanks especially to Sarah Bolton for coming on from the Health Collaborative, and as always, Greg Kesterman, the Health Commissioner. Thank you.